thousands of nurses from 3 different Providence healthcare facilities are on the picket line.
This after failed contract negotiations between the nurses union and hospital management. Fox 12's Amal El-Hal is live at Providence Portland Medical Center talking to these nurses who walked off the job. Amal, good morning.
Good morning. Well, it is expected that 1,800 nurses and clinicians, across Providence's programs will be going on strike starting today. Here at Providence Portland, there are a couple hundred people here this morning. We are also joined by Kyle Cook, who is a striking nurse here at Providence Portland, oncology nurse. Tell me, what are we doing? Why are we here? How do we get to this point?
Yeah, so our nurses and clinicians are out here fired up this morning. We're advocating for patient safety, and what comes with that is making sure that we have adequate staffing, making sure that we have the adequate wages and compensation package to recruit, respect, retain nurses, and get them to come to Providence so that we have a full staff and we are helping our communities and getting back to the bedside.
And how did we exactly get to this point of being on strike? I know that there was a period where you were hoping that Providence would come back to the bargaining table and perhaps this wouldn't have happened, but that didn't seem to be the case.
Yeah, so we issued our 10-day notice 10 days ago. Our bargaining team has been available to bargain. Providence has refused to bargain with us up and through the strike. We're hoping that they can come to the table. We would be glad to come off the line, go back to work, and get to work to our patients. We started bargaining back in October, so it's been months of this. Last week we had a 19-hour session where we just didn't get much movement, and our members basically said, hey, we're ready to hit the streets and make sure that we're really delivering for our patients and for our families and caregivers.
Now, Kyle, you yourself are a part of that bargaining team, so you've been involved in this pretty intimately. How has it been, just on a personal level, experiencing this on such an upfront way?
Yeah, honestly, it can be pretty demoralizing sometimes. You know, we're really advocating for our caregivers, and at the end of the day, we're advocating for patient safety, and there's a lot that goes into that, and it can be demoralizing to not be met with the same type of hype and respect that we're putting out into our communities from our administrators when they're at the bargaining table. So we expect more and we want more.
Okay. And here this morning, we're seeing hundreds of healthcare workers striking, and you said that you expect that number to just grow throughout the day.
Yeah, so the number will grow throughout the day. We're going to have a rally this evening at 5 o'clock where we'll meet here at PPMC and then head over to Fraser Park for a rally starting at 6:15. Nurses are going to be here all throughout the day, all throughout the week. We love community members to come out and join us. We're here for you in the community. We want to come stand in solidarity with us on the line. We'd love to have you out here to support us.
Well, Kyle, thank you so much for joining us this morning. Yeah. Of course, we'll speak to more nurses throughout the morning of why they're here and how they're feeling about this whole experience. Of course, stick with us here on Good Day Oregon for that. Live in Northeast Portland, I'm on Good Day Oregon.
Amel, I can't help but ask, I'm sure a lot of viewers are wondering as well, if we have hundreds of nurses striking, who is caring for patients right now, and how are they making sure that patients are safe, which is what they say is one of their top concerns?
Well, Providence has brought in quite a few replacement nurses in place of the nurses who are going on strike this week. Now, we did speak to the chief nursing officer here at Providence over the weekend, and she said that those replacement nurses are coming in, and anybody who's from the community is coming in for hospital services. If it is an emergency, they say that they will take care of you, but they are asking that if it's not an emergency, if it's something that can wait, they ask you to go to a different hospital system just so it doesn't overwhelm their system. So there are replacement nurses in place for the time being that this strike is going on, but again, not to the same capacity that the nurses here on strike would be providing if they were still at work.
Amel, thank you.